Okay, we've looked at patient satisfaction. We've given you an explanation of patient experience. But why collect patient satisfaction data? Well, there's of course many reasons why we should do that. But I suppose the essential number one reason is that patient satisfaction data does for us. It highlights what's good and what's not so good, and it also generates information around areas for improvement. Of course, there's not one way in which we should collect patient satisfaction data. There are multiple ways to collect that, and one is through, obviously, the traditional route through paper surveys, Pedic surveys. What that does is that enables us to kind of get to a whole range of patients, service users that use our services, and gives us a much greater understanding of what patients view about the services that we provide. But of course, there are other aspects to collecting patient satisfaction data where surveys are not able to kind of provide us with that information. And for those particular issues, we would use focus groups or EBCD, known as experience-based co-design, or one-to-one interviews, and that really enables us to kind of delve much deeper into particular issues around maybe stigma, privacy and dignity, and gives us a much more qualitative view to understanding patient satisfaction and patient experience. The model that we would promote and implement is one that probably works most successfully, is one that aims to work co-productively with staff and service users as equal partners, and that is an important piece of information, as equal partners. And for the next part of the presentation, I'm now going to hand you over to Susan Holt.
Thank you, Ray. So, another reason for collecting patient satisfaction data are CQUIN targets. CQUIN stands for Commissioning for Quality and Improvement. They're targets set by commissioners, and they're important as significant amounts of money are attached to achieving them. Within the CQUIN targets, different categories are covered. One category are patient experience CQUIN targets. And these are what I'm going to talk about now. Our targets for this year, under the patient experience CQUIN targets, we've been given 3 different areas we need to collect data on. The first one is looking at reducing violence and aggression on wards. The next one is the Trust has to assess itself against the NICE service user guidelines, of which there are 15 quality standards. We also need to look at complaint procedures and if service users feel it's easy to complain. The data that we collect at Q1 will be provided to commissioners, and they use them to set baseline figures. So the end of Q1 is the end of June. Commissioners will look at the baselines and identify 6 areas they want to improve our performance on. By the end of Q4, which is March 2013, we need to demonstrate a 5-point improvement against the 6 improvement areas set by the commissioners. This applies for all services within the Trust. So the key message from this slide is that it's really important that teams undertake surveys in June so we get a good representative baseline to provide to commissioners for them to base their ideas on improvement targets. Many of you have collected data for some time through patient experience surveys, but what we're going to tell you about today is a new system which should make it easier for you to administer the survey.